Good morning. The subcommittee will come to order, and I want to welcome everyone to today's hearing on bipartisan proposals, including those in the President's budget, to reform how Medicare pays for care after patients are hospitalized. This is the fifth hearing for our subcommittee this Congress and the fourth in a series focusing on bipartisan proposals to reform Medicare and Social Security. Proud to say that today's effort is truly a bipartisan hearing, with the Ways and Means Health Subcommittee staffs from both majority and minority staffs have collaborated on this hearing. Today's discussion focuses on reforming how care delivered after a hospitalization in the Medicare program is paid for. We'll focus on 5 policies from the President's 2014 budget that are also supported by several bipartisan organizations. Our goal is to discuss the details around the following specific policies. 1, reducing Medicare market basket updates for home health, nursing homes, rehab hospitals, and long-term care hospitals. Creating site-neutral payments between rehab and hospitals and nursing homes. Establishing more stringent criteria for rehab hospitals. Tackling readmissions from nursing homes, and creating bundled payments. The President's budget estimates these 5 policies will save $93 billion over 10 years. And CBO estimates these policies would save less, $54 billion. These are real savings in any case for a program that's facing bankruptcy in just 13 years. The topic for today's hearing was chosen in part from listening to my colleagues. Mr. McDermott, during our last hearing, suggests that we may be cherry-picking proposals from the President's budget that only focus on beneficiaries. Though we still firmly support redesign of the Medicare benefit, we know it's only one factor in the Medicare program that needs reform, and we should look at other items in the President's budget. Today, we're exploring after-hospitalization care because it's in desperate need of reform. It's been over a decade since Congress has made meaningful changes to the way after-hospitalization care is reimbursed. While we recently received some good news from the Medicare Trustees Report, which noted the life of Medicare's main trust fund was extended by 2 additional years, I think some additional perspective is necessary. To me, 2 years is equivalent to the Titanic hitting the iceberg an hour later. We are still in deep financial trouble for this very important program. So I challenge this committee and our witnesses today to think bolder. The question we should be asking ourselves is, how can we extend the life of Medicare for an additional 10 years, additional 20 years, perhaps an additional 30 years? Because we owe it to current and future seniors to meet these goals. These will require hard decisions, but making them now will ensure a vibrant Medicare for generations to come. Before I recognize Ranking Member McDermott for the purposes of an opening statement, I ask unanimous consent that all members' written statements be included in the record. Without objections to order, I now recognize Ranking Member McDermott for his opening statement.